course. So let's do a couple of questions in hematology before we call it a day. I apologize. I'm sorry if I cannot cover the whole medicine. Actually, in half a day, you just cannot cover everything. You can cover as much as we have done. Um, my pace has still been more than average, but I have tried to cover as many things as possible. In hematology, right, these are the common topics which are normally asked. So please have a good read. 69-year-old gentleman, tired and lower back pain for 3 months. What is your diagnosis? So be very careful how you interpret this question. Most significant finding here is your hypercalcemia, right? Then age and lower back pain. These are your most significant findings in this question. Type 2 diabetes and
Multiple
hypertension are
myeloma.
right. Okay. How many people agree that this is multiple myeloma? And how many people disagree? So these are your next question, that what is the most appropriate next investigation? You will do, you see, this is another way of asking question in exam. You will ask for the correct investigation only if you know the diagnosis. So, so you will do serum protein electrophoresis, correct. Serum electrophoresis is your diagnostic test in this condition in multiple myeloma. It usually presents with hypercalcemia, low back pain, renal failure, and hypercalcemia. And you see anemia. This anemia is of your anemia of chronic disease. Muhammad Taya thinks bone marrow is diagnostic. That is fine. I agree. I take your point. Right. I want someone, a junior colleague, to help me, or maybe a student to help me understand these x-rays. No senior colleague is allowed to answer this question, please. So my younger colleagues, students, please help me that what do we see? What is this skull called? Do we call it pepper pot skull, little lesions? Or sometimes we call it point out lesions, you see? And this investigation is called bone survey, right? Looking for the latex lesions. Excellent. Okay, now be very vigilant. I have highlighted in bold the abnormalities. So please describe the results of this blood test. Name 3 causes. So what is the diagnosis? And I need 3 causes. Sajid Hayat, you're right. Nawal, you're correct. You cannot say polycythemia rubra vera at this stage. All you can say, like Razia, that this is polycythemia at this stage, right? It will need further investigation to find out. The differential diagnosis for polycythemia is huge. So it can have primary causes, right? So, and secondary causes, very common. In COPD, in every patient I see polycythemia. And then your apparent polycythemia, people who are dry, dehydrated, they have got their concentrated blood, right? When you lose fluid, when you go to high altitudes, right? And chronic hypoxia like COPD. So on that data, all you can say is that this is polycythemia. Don't commit to more than that, because you don't know whether this is primary or secondary, whether this is polycythemia rubra vera or what is this. So don't commit for anything. So limit yourself to polycythemia. Okay. So what is the diagnosis here? Nawal, what are they associated with? So what is the diagnosis here, guys? I'm still waiting for the correct answer.
Hypersplenism, sir.
Any other options?
Hypersplenism.
That is one. Any other possibilities? Is that really correct answer?
Poisoning, lead poisoning, or some toxic.
This is actually CLL, chronic lymphocytic leukemia. Smear cell is a feature of chronic lymphocytic leukemia. Right. Okay. This is very common question. There are two different kinds of blood cells I'm showing here. And I want you to identify what two types of abnormal cells can be seen and what is the likely diagnosis for this patient. Let's take one question at a time. What two types of abnormal cell? This is the abnormal cell, right? This resembles to something, and this is an abnormal cell as well. So please tell me two different kinds of cells. Sickle cells and target cells. Spot on, brilliant. What a clever gang you are. What is the mode of inheritance of this disease? Name three complications of this disease. Okay, let's take these questions one by one. What two types of cell? Sickle cells and target cell. Likely diagnosis, sickle cell. Mode, autosomal recessive. And three complications of this disease. Numerous, right? But severe bone pain, that's a very common presentation. That is actually the one I have seen so many times. Avascular necrosis of the hip, splenic sequestration, hemolytic anemia, infection, acute chest syndrome when they present with pain. So have a read. These are the kind of things they ask about sickle cell disease. Okay. So let me show you a few pictures. What is this cell? What cell is this? I'm waiting for answer. This is a target cell. What cell is this? And what cell is this? This is normal red blood cell. This is target cell, this is sickle cell, and that is why I've shown sickle, that how it looks like. Brilliant. Okay. Okay. This is easy one. Nawal, you are not allowed to answer this question, right? I know your dad is a cardiologist. So a 36-year-old man who suffers from rheumatic mitral stenosis gets a mechanical mitral valve. He is placed on warfarin. What range is required? Sajid Hayat thinks C. Tahir. The answer is C. I think, guys,